Hi everyone, we continue with the study what men should understand about women. Um, Women, we are going to talk today. Men engaging to job more and spending their time in job. In short, is quality time that should be spent with your family. Some men work for years and children grow up. Do your children really know you? Or do they think of you as a man who sleeps here sometimes and then goes? Here, there are some changes that are required. If you're such kind of a man that you sleep at home for some time, they just know you as a man who comes and sleeps and go, then you need some changes. Does your wife feel neglected? Unless you make some changes, one day you will wake up to find your children grown and your wife is gone. It's as simple as it is. Women need time, and children too need time. In short, a family needs time with you. For physiological reasons, men hunger for sexual release more consistently than women. Women need to be in the mood. And there are many factors that determine this. Among these is the menstrual cycle, the stage of our life in general, the stage of our life in a general, and how the man behaves in the hours leading up to bedtime. Women take time; they are called slow burners, but for the men, they are gas burners, meaning that they go fast, but for women, they take time. And it depends with the menstrual cycle for the women. There are women who are, when they are close to the menstrual cycle, the urge is so high. When others after the menstrual cycle, others during the ovulation, so it matters. The stage of our life. The other thing that matters is the stage of our life in general. Like there are people, mostly the teenagers, 20 to 30s, the urge is so high. And again, they also say the research has shown that the age of 40. The other thing that can determine the urge of women is how the man behaves in hours before leading the bedtime. If you end a quarrel with your man or with your wife before the hours before bedtime, then the urge is so low. But if you end sweet ones, you know how talking good to your wife, a surprise, then you can be so sure that can determine the urge of the sex, the urge for sex for you, the woman. The male's desire for frequency sharply contrast with the female's desire. Not only do men and women differ vastly in desire, but there are also enormous differences between women. Approximately, research has shown that 20% of 100 females might be termed inhibited, which means that they express a negative or a lukewarm attitude to one sex. Most of women are not so close for sex. Like they show they are termed as inhibited at 20%, so you can know that the remaining 80%, but 20% of the women, they are termed as inhibited. That means that they express a negative or a lukewarm. They don't have the urge for sex. They have, and it's normal for them, but the percentage is very low. The answers to a woman's sexual issues usually lie in what is happening between her and her sexual partner, not what is happening in her mind. So if you want to know about the woman's sexual issues, it will lie in the sexual partner, not what is in mind, but what happening with the sexual partner. Whatever you talk to the woman, it depends. The organism capacity in a woman is very strongly tied to her perception and feelings concerning the dependability of a relationship with the people in her life. Men and women have the same half dozen sex hormones, only in different amounts. It is testosterone. It is testosterone that fuels the sex drive in both genders. The fact that men have 10 to 20 times more of the hormone than women is one of the primary reasons that they experience a greater desire for sex. So one of the reasons that men always experience the greater desire for sex is because they have 10 to 20 more hormones than women have, and that make them experience that great desire. Studies shows that some women are more interested in sex during ovulation, when their bodies produce the most testosterone. Other women, particularly those with high testosterone levels, feel sexual just before menstruation, and others even before and others after menstruation. Some appear to be more interested in sex during the first half of the menstrual cycle. Some studies suggest that a third of all women rarely have enough spontaneous interest in sex, and this is so true, to initiate lovemaking. It's a research that has been done, and it suggests that women, a third of the women, that's a big percentage, a third of our women rarely will they start the interest or initiate love making. They may enjoy sex and be orgasmic, but they don't experience a present physical need to make love as men always do. If either partner has an unusually low level of sexual desire, they should report for a complete physical examination. Because again, there are some of the disorders that affect you. There's some people who achieve their sexual desire by just seeing the private part of the other sexual partner. Others experience by just touching. So we have such kind of disorders. So what if you experience you have a low level of sexual desire, you need a complete examination, physical examination of what is wrong with you. If blood test indicates a hormone deficiency, the individual should be referred to endocrinologist. Those people deal with the endocrine system for further testing and treatment. So if your body, because blood takes to be done a physical examination, if your body reveals that you have low level, you show some deficiency of the hormone, then treatment will be done, and you can visit the endocrinologist who deal with the endocrine system to help you better. Problems arise when there is a marked difference between the needs and the desires of husband and wife. Compromise is necessary in order for both to be happy. When a husband needs are stronger than his wife, he does not have to demand intercourse at every whim. So the point is here again. Men may have a heart so high and very strong, but now they begin to force their wife into it. It's so wrong to do it because you're using her like a sexual object. You have to understand that you don't have a child. You have a lady enough or woman enough with a mind to think. And so if they are not in mood, just agree with them. You don't have to demand intercourse at every whim. Understand them and bear in mind that they are also people and they can think for themselves, not to use them as sexual object. Statistics on frequency tend to make us preoccupied with numbers, but studies show that couples in their 20s and in their 30s have sex on average of 1 to 3 times in a week. Couples of 45 years or older report an average of having sex once in a week. But now something interesting is that a study has been done that women in their 40 age actually wish for more frequent intercourse. That is so, I'm not yet agreeing with the study, but the research should be done more about it. Like women at 40, they actually wish for more intercourse. It seems to be close to women at 20 and 30s. The woman who has a low organism capacity is characterized as fear of loss of significant relationship. She feels that significant people in her life will either go away or let her down. She finds it difficult to trust and relax, and her pressure robs her body of its ability to respond sexually. So if you, as a woman, again as we said, if you have a problem with your body, just go for a checkup and blood tests to be done and physical examination.